Esteemed participants to the third Congress of the Romanian Society of Apitherapy, Phytotherapy and Aromatherapy and of the fifth Congress of the International Apitherapy Federation, together with Dr. Rosenberg, we would like to present to you observations regarding the role of health education in promoting natural therapies. We base our observations on the cultural educational project Pharmaceutical Traditions from Sibiu, organized by the Romanian Society for the History of Pharmacy Sibiu section in collaboration with the Brukenthal National Museum from Sibiu Pharmacy History Museum Department. The cultural educational project opened in November 2016 and is still ongoing. One of the purposes of the educational project is to increase knowledge about the history of the development of pharmaceutical practice in Sibiu County and the Transylvanian region. The main purpose is to support health education among the locals and the general public. The general area of interest of the project developed from the context that according to the European Union Health Profile for Romania, edited in the last years, the country is on the third lowest in Europe regarding life expectancy. Also, Romania remains the lowest among European countries considering health spendings per capita. Health education in Romania is absolutely necessary. Migration of healthcare professionals to other countries has resulted in health workforce shortages, especially in the rural area. Romania trains medical professionals well above the European average, but migration remains an issue. Also, patients tend to seek hospital care directly, bypassing primary care. Screening services are not comprehensive. Natural therapies are a big part of Romanian ethnomedicine, but the number of specialists in these fields is reduced. Prevention is the key to the health education combined with the sustainable use of natural therapies. Alternative methods offer the immediate solution. The World Health Organization has emphasized since 1986 that health is too important to be left to health practitioners alone. Education and policy development must be central to the individual, community, and national level. Considering these aspects, we developed four main objectives: thematic visits within the Pharmacy History Museum in Sibiu, thematic lectures given by specialists in the field to the general public to develop a research group in the field of the history of pharmacy and alternative therapies available locally. Last but not least, to organize annually temporary thematic exhibitions related to alternative therapies and to the history of pharmacy. Starting with 2016 until today, we organized and held 53 thematic guided tours for groups in the general exhibition of the Pharmacy History Museum. More than 60% of the remedies in the museum are of plant origin, historical phytotherapeutical remedies. Also, the museum exhibits the unique homeopathy collection comprising more than 2,900 vials. The guided educational tours generated long-term results positive for the small museum and to the project, increasing awareness about the museum heritage, increasing the value of these museum objects in the public consciousness due to the thematic approach through health education, increasing public awareness of the local historical practice of pharmacy and the need for health education, and strengthening the importance of museum objects in the process of scientific, historical, or cultural research. The second objective of the projects were the thematic lectures held by specialists in natural therapies. The lectures were held at the educational rooms within the Brukenthal Museum. Since 2016 were held 24 lectures attended by participants of all ages free of charge. The National Gas Museum, partner in the project, recorded 11 of Dr. Rosenberg's lectures on DVD and distributed them to schools and high schools from Mediaș, Sibiu County, and from the surrounding area of the city. According to the partner, between November 2016 and December 2017, the recorded interviews were viewed by more than 11,000 students. Comparing the data from the 24 lectures, two had the biggest online impact. The one dedicated to natural products from treating obesity with an impact of over 4,000 and the lecture of apitherapy past, present and future with an impact of 3,700 views and more than 1,000 of the first day since posting the lecture online. In conclusion, there is an interest for natural therapies among the general public who wants to learn more. In order to facilitate the access to specialized information regarding natural therapies and to create a network between specialists and the public, one of the project's objectives was to organize and attend as partners different symposia and conferences regarding natural therapies. On October 2017, the National Apitherapy Congress, the 10th edition, held at Sibiu the Satellite Symposium Api History with participants from Romania. In 2018 were held the Api Phyto and Api History sections during the National Apitherapy Congress 11th edition, and you can see from the images the two sections developing at the museum. In 2019, we organized the National Symposium Natural Therapies in Current Times. The symposium addressed the role and place of complementary and alternative therapies in the medicine of the third millennium. Special emphasis was placed on the possibility of using phytotherapy, apitherapy, aromatherapy, homeopathy, dietotherapy, balneotherapy, and other traditional therapeutic methods in the prevention and treatment of certain diseases. Our activity continued online during the pandemic, and in 2020, we participated at the online National Symposium Agriculture and its Implication in Food and Human Health. The papers addressed the role of agricultural and biological sciences in significantly improving health and reducing the risk of disease through nutrition. The theme of the symposium was based on the synergy between various research fields, including natural therapies. On July 2021 and October 2021, we organized two online sessions of communications dedicated to aromatherapy and to homeopathy in Sibiu, past and present. Due to the interest and development of complementary therapies in 2022, many of the natural remedies from the past returned in the attention of pharmacists from Romania and also doctors, and so we organized a webinar from nature into the pharmacy with participants from India, Africa, Australia, and Romania. Considering the webinar success from 2022, the next year we organized the online conference Integrative Medicine Today with an international participation and audience. The interest to integrate traditional natural therapies into modern medicine was the topic for the 2024 webinar. The participants from Romania and abroad presented papers from the areas of phyto, api, and aromatherapy, and also homeopathy. Temporary thematic exhibitions related to alternative therapies were another of the project objectives. Since 2017, we organized 7 exhibitions related to natural therapies and health education. The exhibitions were held at the Natural History Museum and the Pharmacy History Museum in Sibiu. The first exhibition was dedicated to celebrating 240 years since the father of homeopathy, Samuel Hahnemann, visited Sibiu between 1777 and 1779. The concept of the temporary exhibition from 2018 was that of professionals who dedicated their careers to health education, like pharmacist Marin Vasile from Romania, who donated to the Pharmacy Museum its entire collection of Romanian pharmacopoeias. Another personality celebrated during the project in 2019 was Ovidiu Maior. His research in the history of pharmacy has led to what the museum in Sibiu is now. On October 2019, on the occasion of the National Symposium Natural Therapies in Current Times, we contributed to the opening of the temporary exhibition Present-Day Natural Complementary Therapies, presenting herbariums as old as the 17th century to the 19th century, composed by pharmacists and doctors. During the pandemic in 2020, we initiated the online exhibition Pharmacy, the Art of Healing, reinterpreting old remedies according to today's knowledge. After the heroic efforts of the Romanian doctors in fighting COVID-19, it was only normal to dedicate an exhibition to them, and so we opened Medical Naturalists in Sibiu, including renowned physicians who worked in Sibiu area during the 18th and 19th century and contributed with their research to the development of the Natural History Museum from the city. The evolution of pharmacy over time must be viewed in close connection to the development of the society, but we must not forget that nature, respectively the environment, has provided man with resources used for centuries as remedies. The exhibition From Nature into Pharmacy reconnected current trends to natural therapy used in the past in pharmacies. Thanks to the Brukenthal Museum and our partners, in 2019, Dr. Rosenberg launched the volume The Role of Complementary Therapies in Current Medicine. It was a landmark moment in our project, and we are hoping to achieve new ones in the future by creating models of good practices regarding health education at national level, by continuing thematic lectures at the request of the public, and by developing new collaborative projects between institutions. Thank you for listening to our presentation and to the organizing committee of this event.